Senator.
Good to see you, Senator.
Thanks for including me. I apologize in advance for that previous commitment at 10 o'clock. So take care of me. Let me jump off. Thank you.
No worries.
We're glad you're here.
Well, I always say, you know, I'm one of us, you know. We need to get more seniors in the legislature. That ought to be our #1 objective.
There you go.
Yep. I like it.
Well, we're still waiting for Senator Moreno and Representative Ransom to join. While we're waiting, I want to point out the screen here that shows our sponsors, and we want to really thank all of our sponsors. Metropolitan State University, Department of Social Work, the CU Multi-Disciplinary Center on Aging, which Jody Waterhouse is a part of, the Seniors Resource Center. We had Chris Lynn was on our webinar last week and spoke about that. InnovAge and our Colorado Senior Lobby Board of Directors, and then Primetime News are our sponsors for today. So we appreciate that. And I also want to take a minute and thank the team that has been working on these webinars for the last, I don't know, it seems like a year, the last several months. That would be Kelly Roberts, Chris Gierkin, Corinne Hall, Jody Waterhouse, who's on the call here with us, Blaine Cole, Rich Morrow, and Jeanette Hensley. So we appreciate all the work that you all have done to make this happen. And let's see if anyone else has come in as I need to promote to a panelist, and I don't see anybody yet. So I'm going to get started with at least doing an introduction of our panelists. I see, give me a second here. Okay, that's good. So Rich, you're going to be monitoring the Q&A, right?
Yes.
Okay. Okay, well, I start with Senator Moreno, who will be joining us soon. Let's see here. Make sure I haven't missed him. Nope. Senator Moreno serves Senate District 21, which covers a large portion of Adams County. Senator Moreno is a native of Commerce City, graduate of Adams City High School and Georgetown University, which he attended through a combination of scholarships and part-time work. Senator Moreno is a strong believer in the value of public service and in volunteering. He served on the Commerce City City Council for 3 years, followed by 6 years as a representative of House District 32. He was elected to the Senate in 2016, serves as vice chair of the Joint Budget Committee, and has been a member of the Joint JBC for 2 years. Senator Rankin, who is on with us there, Senator Moreno right there, and Representative Ransom. Good morning. Senator Rankin represents Senate District 8, which covers much of western Colorado. He describes his district as the most economically and geographically diverse in the state. Senator Rankin is a graduate of Mississippi State University, served 6 years on the Colorado House of Representatives prior to joining the Senate, and has served a total of 6 years on the Joint Budget Committee, and hopes to continue as he is up for election in November. Senator Rankin is an Army veteran and has extensive business leadership experience in the field of defense and computer electronics. Representative Kim Ransom serves House District 44, which covers parts of Douglas County, and is also up for re-election in November. She's a graduate of California State University and holds an MBA from Cal State Long Beach. Representative Ransom was elected to her position in 2014, and prior to that, served on the Douglas County Planning Commission, worked for several years for Vacation Rental by Owners, which has become a huge company, and worked as a legislative aide in the Colorado Senate for several years. She has served on the Joint Budget Committee for 2 years. Okay, so I hope I didn't misspeak on any of those introductions. I pulled all that information off your websites. So If it's wrong there, it's wrong here too. Okay, so I think everybody, most of the people on this call probably know the rules here of how this works. If you have a question, put it into the Q&A, which you can access on your screen. We prefer that rather than chat, but sometimes that gets forgotten, and we'll still look at the chat. And the other part of this is none of the attendees really have an opportunity to speak unless we get to the end here and we have some more time. We might open it up for people to ask questions orally. So Senator Rankin is only going to be on the call till about 10 o'clock. He has a previous commitment. And I guess I would like to start with Senator Rankin, mostly because you've been on this Joint Budget Committee for the longest time. And a lot of people on this call don't even know what the Joint Budget Committee actually does. So could you talk about that, please?
Well, yeah, thank you, Bob. That's quite a subject. Uniquely in Colorado, the legislature has a lot of control over the budget through the Joint Budget Committee. Many states, the executive department really sets the budget, but in Colorado, the governor has suggestions for the budget, and he submits those in November, and we go to work. The Joint Budget Committee is 6 people elected in most cases by their caucus. So there's 2 caucuses in the Senate, 2 in the House, and depending on the majority, it can be, right now, it's 4 Democrats and 2 Republicans because of the makeup of the senators and representatives. So we start in November, and we call it the governor's suggestions. Some people call it the governor's budget. And we work through until in late March, we present that and have to get the vote of the entire legislature on the budget. That requires that we dig through as a panel. We have 13 really great staffers. Each of them take 1 or 2 departments. We work through 22 different departments and agencies in great detail, and their existing budget and the things they would like to change. And then we true up, and come around January, we true up this year, the current year's budget. And then in March, we present that to the whole legislature. And they, it's sort of funny. At that time, they wake up and realize that the budget is policy, and all these other legislators try to amend what we have recommended. So that's always a fun process for a few days in March. We call it Budget Week. So that's pretty much what we do. We have our own office suites with our own hearing room, and we work every day, whereas most other committees meet twice a week. We meet every day in every possible gap between the legislative session process to come up with that budget. There are some really, I believe, great documents online presented or prepared by our staff. So you can actually go to JBC budget documents on a search and read just what I think is the best description of state government and policy that exists anywhere. So I would invite anybody to go read some of those. Budget in Brief is a good one, and our appropriations report goes into great detail on what each department and each line item in the budget does. It's interesting work. I call myself the longest surviving member, and Senator Moreno is the other one who's been there a while. There is some turnover. We'll have, I think, some new members this year. So it's the learning process to work on the budget committee. I think it took me a couple of years to actually feel comfortable with the process and the budget. Good work. We work about twice as hard, maybe 3 times as hard. I'll let the others comment on that, but I think we do. But it's so rewarding to really know that much and learn that much about our state government and work with some fantastic people who work in the executive and other departments. So yeah, thank you for allowing me to be the one to try to explain that.
Okay. Thanks, Senator. Senator Moreno, Could you talk a little bit about how you adapted to the constantly changing pandemic situation, and how was it different leading your jurisdiction in the state? How's that changed from the beginning of the shutdown to now that we're settled into whatever normal is today?
Absolutely. Thanks for the question, Bob. So thanks for having us this morning. It's great to be with you all virtually. So, the pandemic was a really, interesting experience, unlike anything that I think we've ever experienced before. In prior years, you can see a recession coming. You can see the economic downturn, you can see the signs, and there's a certain amount of planning that you're able to do for that. This was unique in the sense that there was no planning time whatsoever, right? The effect of the coronavirus was widespread and quick. And then the subsequent kind of economic shutdown that was necessitated by the effects of the pandemic were also very quick and unplanned for. And so that piece was really interesting because we kind of, we got our usual quarterly forecast that kind of tells us, this is how much revenue you will have to allocate in the state budget this year. And obviously the news wasn't good, but we knew that it was going to be much worse because the real shutdown didn't occur until after we really received those that quarterly forecast. And so we knew that the economic effects were going to actually be much worse. And so in kind of an unprecedented procedure, the Joint Budget Committee actually asked our two economists. We have essentially a team of economists. One is Legislative Council, which is the nonpartisan agency of the state legislature. And then the other economists are the Office of State Planning and Budgeting in the governor's office. And each one of those entities produced those economic forecasts that I was referencing. In an unprecedented situation, we asked them for an update. We asked them for, we say, we understand that you usually give us these updates quarterly. We actually went even to, I see we have someone here from CU. We went to CU even and asked them to give us their economic forecast and what they might expect might happen. We literally were pulling information from whoever we could get it in order to try to make the best decisions for the state. So what happened is that they produced essentially these mini forecasts. They weren't quite as expansive as the quarterly forecasts that we get, but they were still information that gave us an indication of what the unemployment numbers were looking like, gave us an indication of how businesses were doing, how tourism was doing. And as you might expect, the news wasn't great, right? I mean, it was almost a complete economic shutdown because of the pandemic. And so that was a very interesting experience because we really had to, we had to utilize the information that was coming in real time to then present a balanced budget to the rest of our colleagues. We were about 98% complete with the budget when the legislature took a pause and then had to come back. So what is normally a 5-month roughly process for the budget, we crammed into 3 weeks. And we received that updated information through those forecasts and then proceeded to figure out how are we going to plug this $3 billion hole that we were seeing in our state budget. It wasn't easy work, and those were long days for the Joint Budget Committee for 3 weeks straight. We met from 9 a.m., often past 5 p.m., to try to get through all of these decisions and make the best decisions that we could. That obviously resulted in us presenting a balanced budget to our colleagues, which then they considered during the abbreviated legislative session when we returned for our work. And so proud to say that even in the midst of a pandemic, Colorado's reputation for having a budget, a balanced budget on time was not tarnished. We still met that requirement. But this has been a really just bizarre time. And I know I can, I know I speak for the rest of my colleagues on the Joint Budget Committee, because actually we're all up for re-election. And public service is a people business. This is usually my busy time of going to every backyard barbecue, going to every coffee, going to every ice cream social that is happening this summer, and reconnecting with people and hearing what they would like to have happen next session, hearing their concerns. All of that has really been upended. And so we've had to figure out new ways to interact with our constituencies and to figure out how to campaign in this crazy environment. For me, that has meant a lot more Zoom town halls, a lot more forums like this, which is different, but still good to be able to connect with people. And then otherwise, it's been a lot of phone calls. Now things are starting to get a little bit back to normal. The coffee shops are now open again, and you can go meet someone for a cup of coffee to hear about their concerns. And it's starting to get back a little bit back to normal, but it's certainly very different. People out on the campaign trail, people were reticent. They're hesitant to open their doors before, and now even more so, because they don't want to be exposed to anything. And so that piece has been pretty interesting. But I am hopeful that we are on the road to recovery, that things are opening back up. We saw through our latest economic and revenue forecast that perhaps the news isn't as bad as we expected, that revenues are coming back a little stronger than we thought, which is great news for the budget and great news for hopefully restoring some of the cuts that we had to make. We will be getting more information on that subject specifically this Friday. We get our September forecast this Friday. And so I think all of us are really looking forward to hopefully some good news after many months of bad news.
Thank you, Senator. Representative Ransom, would you like to jump in and answer that question as well?
Sure. Thank you so much. You guys can hear me okay?
Yes.
Perfect. Yeah, well, Senator Moreno actually said it quite well, that we had to come back very quickly. He did leave out that those long days also included at least one Saturday, so that when we talk about being devoted and actually willing to go the extra mile on the JBC, I think all of us are absolutely willing to do that. I do agree that we are seeing some strong movement that's positive. I would like to see more. I would like to, I just heard of another business in my area, a restaurant with 5 different locations, and some of them are in the metro area, I think, that is going to be declaring bankruptcy soon if they haven't already. And I mean, that just breaks my heart when I see a locally owned business of somebody with their life savings sunk into it that is going to lose it all, because of what has happened here in Colorado over the last 6 months. That being said, the way to really undo it, to really get through it, is for us to, have some real solutions, not just to the reopening businesses, but also to the people's fears of this, of the COVID-19, whether it's via, things getting better under control, whether it's a cure, whether it's a vaccine. I just think we are all hoping to see some positive movement back to normalcy. And that's what I'm hearing from my constituents, is everybody wants to be back to normal. So with that, yes, we are having a new forecast this week, so please stay tuned. We'll know more then. The other piece of that, with dealing with the pandemic and then also trying to recover the state budget, clearly we have an election coming up that is going to potentially change state revenue. Remember, there are a couple ways to balance the budget. One is to make cuts. The other is to increase revenue. So I think we all are just watching the results of the election to see how that works. Because clearly, as businesses reopen, that will increase revenue as well, because people will be buying more and businesses will be earning more.
Okay, thank you, Senator Representative. Senator Rankin, would you care to comment further?
Well, just to put Representative Ransom's last comment in perspective, our forecast that we are working to for this budget from July to July, the one we're currently in, said that we would lose 25% of the state revenue. That's because economic activity in the state was forecast to be down 25%. So if we think about getting back to work, which I like to talk about, if we just improve 1%, that is, if we're down 24% instead of 25%, that's $60 million. You know, we're talking about a huge impact. $3.3 billion was taken out of our spending plan because of that forecast. So we're looking at that forecast this week. And if we can start to improve, if we can get back to work, then it just has a huge impact on the budget that we'll be considering that will start next July. So I would say, you know, that's what we're watching. I would encourage everybody to watch that. But, you know, it's very difficult to generate new revenue through new sources. I mean, the number one source is getting back to work.
Okay. While you're up there, Senator, I have a question here from Phil Cernanik, and I'll ask the other two panelists to comment after as well. Many older Coloradans are on fixed, limited budgets. Yet the priorities for those Coloradans, which is housing, nutrition, healthcare, and mobility, have experienced increasing costs and/or restrictions in availability. What do you see coming in the 2021 legislative session to provide relief and assistance for these older Coloradans?
Well, I think there are really two major issues. The area agencies on aging and keeping, you know, I hope that we can find stable funding, and we've had a somewhat unpredictable source in the past. And the other is the senior homestead exemption. Those are major issues. And then there are a number of other line items that impact aid to seniors. I digress a little bit. I think, and, you know, I'm one of us, of course. I'd say, you know, I wish we had more seniors in the legislature. So that's something we ought to work on. All of you listening, consider running for office and help me out here. But, you know, beyond that, I would encourage us to produce, you know, continue to produce, Rich and all of you, really good demographics on the growing senior population, and then overlay that with the needs that have already been there, but have been exacerbated by the COVID situation, the pandemic, because, you know, we're going to need that information as we consider all of those line items starting in November. Everything will be on the table. We have to be aware. I mean, you know, we'll be starting over. We probably will have to take another $1 billion, 10% or so, out of spending, just because we used a lot of one-time sources last year that don't exist. So I think we need to be, those line items are. I can't enumerate everything right now that goes through all the, you know, the Medicaid support, you know, folks are on both Medicaid and Medicare. There's a lot of issues that we have to address, but I think what I would ask for is that kind of support. Let's get our demographics in order. Let's look at the impacts of COVID and reach out to your individual legislators. I always say that. There's two things I say every time I talk to the senior lobby. One is run for office so I get some help here. But the other is, you know, get your local legislator, you know, involved. Take them to the centers, let them meet some seniors, let them really understand these needs, because as we present this budget, we're going to need a lot of help.
Bob, if I can jump in real quick, Senator, this is Rich Morrow. Just comment on what you just said. We are actually already working on putting together some data as you suggest. And actually have had a meeting with JBC staff to talk about what we're working on from the Area Agency on Aging side. So you all can expect to hear from us later this fall, hopefully providing you with some useful information for those decisions. Thanks.
I would expect no less, Rich, and I knew you were doing that. I just wanted to say it. Okay.
Thank you. Appreciate it.
Okay. Senator Moreno, would you like to comment on that as well?
Yeah. So, you know, it's interesting. I think what needs to be top of mind is how the current pandemic has really affected senior populations. You know, nursing homes in particular have been really hit hard, which disproportionately serve senior populations. And so, you know, we need to be mindful of those things. And I do think our nursing homes are really struggling. And I think we will need to do something in the budget next year to try to alleviate some of that stress that they've been experiencing, because, you know, because people are worried about coming to work and possibly contracting the virus, and then, you know, then transferring that virus to their loved ones at home. So there's been workforce issues, there's been issues of PPE, there's been, you know, all these things that have really come together that I think have really affected our senior population. So we really need to look at things on that front. For the AAAs, you know, it's unfortunate that the older Coloradans Services Fund, we are in such a different place even, you know, a year ago. We had this situation where that fund had developed a balance over time, and we were trying to figure out how can we sustainably spend those dollars to expand senior services. And we were working very closely with the senior lobby and the AAAs on that plan. And then obviously this huge budget hole happened, and you know, things changed. Unfortunately, resources get diverted elsewhere to kind of manage the damage that we saw in the budget. And so, you know, I'm hopeful that we'll get back to that place again where we can really think about how do we expand services. Right now, we kind of took the approach of protecting what we have, and that's what we had to do in this budget. But you know, in the future, we are going to get to a place, I think, hopefully, that we can have that conversation about really expanding to seniors who need the services. We know that there is constantly more demand than there are available services or available funding for those services, and so we do need to have that conversation going forward. And I'm hopeful that we'll get there soon.
Thank you. Representative Ransom, would you like to comment on that, please?
Sorry, that was a technical microphone thing. So yes, I think that there are services that we need to make sure that we take care of. I think that there are certainly competing issues in the budget, things that have to be covered, as well as things that should be covered, as well as things that may not be covered. So clearly there's a lot of juggling priorities, which is why our Joint Budget Committee we have to work together well. And it's kind of fun to work with people on both sides of the aisle and do that work with juggling priorities. Because I do think that if we're you know, trying to increase taxes on these people with a fixed income at the same time that we try to give them more services, it ends up being a net neutral. It's not helping anybody. And so I just think that there's a lot of things that we will know after this coming up forecast, and then of course we get quarterly forecasts. So in December we'll know even more. And then clearly when we start looking at the upcoming budget for next year, I think that we will have some better ideas about just what to expect, where we'll be able to, you know, fill those gaps. Because I think all of us want to make sure that people on a fixed income aren't suffering. I mean, clearly, I mean, that's something that we need to make sure. So.
Okay, thank you. Senator Rankin, a question before you go. Do you expect to see the governor relinquish his emergency status before the session starts?
Well, I expected him to relinquish that in June. So I actually was Senator Woodward and I ran a resolution, tried to get the votes. The legislature could end the emergency declaration by a 2/3 vote, but that's not likely to happen because it would require a special session and 2/3 vote, and we couldn't get it done then. I don't really know what he's thinking about this. I would say from my perspective, my party's perspective, he ought to end it and let the legislature is just being left behind. Many of his executive orders read like laws. And so I'm not quite sure, for example, how we sort all this out if and when we get back to work. But, we're a part-time legislature. We actually have no authority unless we call a special session and do something. And so, and the governor's totally within the law, we believe, to extend this. I always thought an emergency declaration would be tornado or flood or fires. I mean, and should be, and would be regional and local. So how long can this go on? I don't know. Other states are doing other similar things. Actually, the governor's getting pretty good reviews for his efforts to protect us, mask orders and set-asides. We're doing pretty good as a state. And we are trying to get back to work, I'll have to say. I don't think it's fast enough. I think we ought to be, be very aggressive to get back to work because of what we talked about earlier. Getting back to work is the way to produce revenue to fix some of these budget holes. So I have no idea in answer to your question.
Senator Moreno, what's your crystal ball say?
Bob, if I may I jump off? And I really apologize. It's a great group, and I'm honored to have been with you.
Thanks for joining us, Senator, and have a good day. All right.
Thanks, Senator.
Yeah. It's an interesting question. I think there has been a lot of tension between the legislature and the governor's office on this very subject. We did, Senator Rankin and I did carry a bill towards the end of session. It was one of the last bills that was passed. Also, one of the last bills that the governor signed. That's more on that story later. But it was a bill to actually try to put some sort of at least some reporting requirements on the executive branch on, when they issue executive orders, the legislature should be notified before those executive orders are public and before they're published. And we should get a comprehensive list of all those executive orders. And really, we should understand how the money is moving. So the governor did allocate the vast majority of the CARES Act funding, the money from the federal government, through executive order. And so we wanted to make sure that we at least had a handle on where those dollars were going, how they were being spent. Because obviously there was the CARES Act funding, there was a lot of logistics to try to figure out on how we were going to get those dollars out the door quickly in order to have the greatest effect on relief for our communities. And so, had those dollars kind of gone through the traditional budget process, they do much longer for those dollars to be allocated. But we wanted to make sure that, as these executive orders are being issued that either spend money or that, respond to the pandemic, that the legislature is included in those notices, in the development of those executive orders, and that at least somewhat regularly, the executive branch does come before the legislature and explains their reasoning for either why they're extending certain executive orders or things like that. And so we've already had one of those meetings. I thought it was a productive meeting. There was a lot of good information shared. And so I think, in general, there's always room for collaboration between the different branches of government. And, I'm hopeful that we'll continue to get to that place. But, I honestly don't see us being out of this situation really until there's some sort of vaccine developed where we can, have a greater certainty of knowing how the virus travels, and hopefully putting a stop to any kind of spread that we see in different communities.
Okay, thank you. Do you want to comment on that, Senator? I'm sorry, Representative Ransom.
Certainly. Thank you so much. I will very quickly. I think it is absolutely time for the state of emergency to end. What the state of emergency is a one-size-fits-all executive order for the entire state. We have seen in areas of the state where the cases of the virus are low to none, yet they still have the masking order, for example, and they still have, you know, this various order of the stages. And I get that they can apply for variances and things like that, but that takes time and money and FTE manpower to complete those variance requests. And in order for people to get back to work, I think they need to maybe make some of their own decisions. I can't stress enough that I think a one-size-fits-all answer is not the right answer for Colorado. I do think that both of my colleagues' answers previously were right. I appreciate the legislature hearing what the governor has said and why, but he is still issuing a state of emergency where in my world, I don't see one. You know, in my county, the cases are so low. And, you know, initially, the reason that we had the shutdown order was so that we could get PPE and get the hospitals under control. And then the bar kept changing. And now, as you just heard, people are looking for a vaccine in order to end the state of emergency. And I'm saying, wait a minute, that's not the same reason that we started this shutdown 6 months ago. I think we're creating some economic problems via executive order.
Okay, thank you. Rich, do you have some questions?
Yes, we do have some questions I wanted to get to. So Senator and Representative from Ed Shackelford, we have a question. How has the pandemic changed or had an impact on your priorities for the future? Senator, you want to start?
Sure. Yeah, I think it's a great question. I mean, you know, I do think that the pandemic has really exposed some glaring gaps and flaws in our system. You know, one, we were not prepared for the number of people who would unfortunately have to submit unemployment claims. That was evidenced by the number of constituents that I had reaching out to me who said, you know, we have no possible way of getting through to the unemployment office to get these benefits that we're going to need to be able to stay in our homes or to be able to just afford our basic necessities. So that's one thing, is that I do think that it's really exposed the flaws in our system and how ill-prepared our social safety net is to accommodating like a dramatic change in how this pandemic has affected our society. And so, you know, going forward, how that has shifted my priorities is how can we do a better job at bolstering that social safety net of really, you know, making sure that we're accommodating folks, that we are efficiently getting them the services that they need. But also that how can we, you know, better respond to when there are these huge influxes of folks who do need support from the state? How can we better accommodate that in the future? Because this last round, it was not, it wasn't successful. We didn't do a good enough job. And so that'll be top of mind for me in the future, and that'll be one of my priorities.
Thank you. Representative.
Thank you so much. Yes, the unemployment claims process, just the people in that office, I know, were working huge hours and doing their best to try to keep up. They knew that they were essential workers. They had their jobs, and they, for a very solid reason, they needed to make sure that people that had lost their jobs could get the unemployment benefits that they had been paying into, or their employer had been paying into for, you know, for years. And these, you know, these people, I was getting, you know, phone calls and emails from people that would have their rent due in a week or two, and the unemployment was several weeks behind, and they didn't want to get thrown out of their apartments. I mean, it was heartbreaking all around. And so I do agree that we need to work really hard to make sure that we have the bandwidth to cover these unexpected influxes when and if they happen. And hopefully we won't see this again in my lifetime. But that being said, let's work on it now to make sure that when it does happen again, that we have routines, that we have procedures that kick in quickly, where we can address the needs very quickly. But then the other piece of that, changing, when you asked about how it's changing my priorities, that's really a question that we're going to see in the upcoming budget. When we realize, you just heard Senator Rankin say he's expecting another $1 billion of cuts. That's on top of the $3 billion that was already cut in this year's budget. That's a heavy lift. It's a hard burden to carry, and to find those areas is, yes, it's a priority to figure out the best way to make that happen without hurting people, with maintaining what we have, yet still trying to reach those corners. And then clearly we have constitutional requirements, i.e. with K-12, that we absolutely have to meet. And, it's going to be a huge juggling act. I think all 6 of us are going to need some red pens, and I know Senator Moreno is going to laugh at that one. We're all going to need some red pens, and we're just going to need to work hard at working together and figuring out the best places, to make the budget work, because by law it has to balance.
Thank you. Okay, so we got another question from Charles Gatto. With so much commercial activity shifting to online, is the state able to fully collect taxes on these purchases, goods and services? Who wants to take that one?
I can start there. It's a great question, and we have seen, in these economic forecasts, we've seen a dramatic shift to online activity for many consumers in Colorado. Actually online activity, and I'm sure you could guess the other one, grocery sales, were the two that just spiked through the roof during this time. And so we'll get some updated numbers on that this Friday to see kind of how much folks have shifted to online purchases during this time. And it was dramatic last time. I'm sure it'll be even more dramatic in this update. I would say in a few years ago, my answer to that would have been no, that we don't properly collect sales tax on online purchases. But that has really shifted in recent years. Many of our vendors, our online vendors, have really done an incredible job at collecting that state sales tax revenue and remitting that to the state. We have also had this sales tax simplification task force that has been meeting over the last few years to figure out how to make it easier for businesses to comply with collecting sales tax. Because if you think about it, it's actually a nightmare for businesses, because you not only have the state sales tax, you also have every other local jurisdiction that you are responsible for collecting sales tax for. So that might be the city, but it's also the county. It's also different local special districts that may have their own separate sales tax rates. It's a complete, honestly, nightmare for businesses. And so they've done some really incredible work. They're figuring out how to make it as easy as possible for businesses to comply with, and streamlining between all those different government entities. So I would say, yeah, we're in a much better place on collecting sales tax revenue from online sources than we were a few years ago.
Great. All right. Let's see. We have another question.
Okay, Rich, I think Representative Ransom wanted.
Oh, I'm sorry. Yeah, I'm trying to remember not to forget the question. Sorry. Go ahead, Representative.
Well, Thank you. And actually, Senator Moreno just answered the question really well. I know I've bought things online over the last 6 months, probably more than I had in the past. And I absolutely see the vendors having a line for sales tax. And I know that it's correct because I'm in the legislature and I know what I'm supposed to pay where I live, and they are collecting the correct amount. And so I see that happening. I presume it's happening throughout the state. Wasn't that, and Dominic, you can nod, wasn't part of that the Wayfair decision that we addressed in the legislature? So we've implemented that here. And I know that the Department of Revenue really tried hard to work with all of the business entities in Colorado just to make sure that everything was being applied consistently as it should have been.
Okay, great. Let's see, we've got a few more here. One question from Mary Dean Purvis, basically asking if you could comment about how Colorado's situation has compared with our neighboring states. Have you guys heard much about that? Representative Ransom, why don't you start this time?
I have heard more anecdotally about other states because I do get maps. I get lots of newsletters from groups like NCSL. And then just, of course, reading the news, I see that, for example, California still has a lot of orders in place. They have a higher case rate than we do. So they are actually under, more stringent requirements. But I also hear of other states that have little to no requirements, and those states are presumably doing better financially. That being said, I think you need, my best answer to that is going to be stay tuned. We will be seeing more statistics over the next couple of months. I like seeing what other states do. And my favorite question, it's not my favorite question. I love working with Senator Rankin, who just stepped off, but one of the questions that he very often asks when we are looking at line items and voting on them, he says, what are other states doing in this area? And he very often wants to hear how other states are handling it, because if somebody's already invented the wheel, that being said, we still need to look at what is unique to Colorado. So I don't necessarily need to do exactly what Nevada does or what Utah does or what California does. I want to make sure we're addressing the needs of our state. So it's a balancing act. If we can get wisdom from the other states, great, but we also need to address the needs of Coloradans.
Senator?
Yeah, I'll just add that, Colorado's, the effect of the pandemic on Colorado was a little bit more dramatic than other states. That's for a number of reasons. One is obviously like tourism is a huge industry here, and people really for a period of time stopped traveling, and we were not, at one point our hotel vacancy rate was, just through the roof. Usually during the peak time, summer and during the periods that we saw the pandemic hit hardest, our hotel vacancy rate is like less than 10%. And during the really intense times of the coronavirus, the hotel vacancy rate was something like 90%. So it was a dramatic shift. And so obviously that means that people are not here spending their dollars, right? They're not supporting our local businesses. And so that did have a huge effect. And so it was a little bit more dramatic in Colorado compared to our neighboring states. With one exception, I will say I was just on a call with NCSL this past week where they were talking about the effects of the pandemic on different states. The one exception is that the Wyoming's kind of oil reserves account basically cratered. It completely almost was wiped out, and obviously a state like Wyoming that they are even far more dependent on natural resources and oil and gas development than we are. That's been a huge challenge for them.
Yeah, great, thank you. So Phil Cernatic had another question for you both relating to the a situation where you had to divert the vendor fee that was adopted a few years ago or tapped a few years ago for some affordable housing, and wondering when those funds might be redirected to go back to that original purpose. So do you want to take the first crack, Senator Moreno, and then we'll ask Representative Ransom?
Absolutely. Yeah. So a couple of years ago, a bill was passed to redirect some of the vendor fee dollars. It put a cap, and the vendor fee is actually, we were talking just a little bit more about collecting sales tax, right? The vendor fee is essentially an offset for local businesses that they can, essentially bill some of their expenses to the state through this vendor fee and receive a partial offset for what they collect in state sales tax. That's essentially the vendor fee. And we passed a law a couple of years ago that redirected some of those dollars by placing a cap on what businesses could qualify for the vendor fee. Before, there was no cap. It was kind of a percentage of the revenue that you collected. And if you think about some big box stores, big corporations were collecting kind of a dramatic amount of money through the vendor fee. And so we did put a cap there, and some of the revenues that then generated was able to go to, one, affordable housing, but the other was the reinsurance program that was passed a couple of years ago that makes premiums more affordable on the individual market throughout the state. So the good news first is that the portion that does go to affordable housing through the vendor fee changes was maintained in this year's budget. We did not redirect those funds. We worked really closely with Representative Wiseman, he's a very big proponent of those dollars going to affordable housing. So a portion of those funds will still be going to affordable housing. I think it's like $13 million. But the other purpose that it goes to, reinsurance, those dollars will continue to go to reinsurance until this new mechanism is established, which actually just happened in the last legislative session. We passed a bill called the Healthcare Affordability and Sustainability Act, which essentially continues an assessment on health insurance plans to then continue funding the reinsurance program. So once that kicks in, the reinsurance portion of the vendor fee will go away, and those dollars will flow into affordable housing. So in the coming years, you can see an investment from the vendor fee to affordable housing, I would say around $20 to $30 million a year, but it's going to take a couple years for it to kick in because the reinsurance program will need to shift to that new fee, that new sustainability enterprise before you can really realize the benefits from the vendor fee going from reinsurance to affordable housing.
Thank you, Senator. Did you want to comment, Representative, on the vendor fee?
Honestly, I think you just got a really good explanation of the whole vendor fee and how it's split. So nothing to add.
Thank you. The last one I think I have on my list here, I'm going to paraphrase a little bit from Ed Shackelford, basically about how public health has factored into all of this. And maybe I think he's somewhat alluding to maybe similar comments that you had in the recently about how some of the lessons learned and maybe some of the gaps and weaknesses in the system that this experience has revealed. But he's just wondering, what comments you might have or plans for the future regarding Colorado's public health infrastructure. Representative, did you want to start?
Sure. I think that the public health is a different question than what we are talking about when we discuss the senior lobby, mainly because Medicare is such a big part of anything that the seniors are getting and using as far as health insurance coverage. That being said, there are so many seniors that need the additional the additional plans. And I'm sorry, I'm not that age yet, so I know there's part A and part B, and there's the pharmaceutical piece. I'm sorry, I'm not. Someday I'll learn, and I'll be able to speak much more intelligently to the way Medicare covers.
Sure.
I'm clearly much more familiar with Medicaid. I know plenty of people get both, and I clearly know that we have a significant portion of our population that need and get Medicaid. So that is part of the public coverage. But then I'm presuming he's also talking about the public option, which is a bill that we saw that we might, and I think the majority party can probably answer that piece better than I can, because the public option and having that as an option for people to buy their health insurance through that's a different question. And that, I think there would be a different set of requirements for seniors than there would be for the general public that are just looking for another option for their health insurance. And I do think that I've seen it happen in other states. I do know that the costs are often very, very significant, and especially right now when we're trying to cover things and looking at a downturn in revenue. I'll just a hint from me to you. I'm guessing that we don't have the money to actually implement something that's going to a new program that's going to cost that much. But again, I would defer to the majority party because I think Senator Moreno might have some more insight than I do on that.
Well, before you go, Representative Ransom, since you're in Douglas County, I know part of its question has to do with the public health agencies. And there have been quite a bit of controversy, especially in Douglas County, related to some of the health orders that have been put into effect. And there have been threats on people and who work in those places. I mean, can you comment on that?
Certainly. And I'm sorry if I misunderstood the public health agency versus the public option. But yes, I've been familiar with what's been going on. My response to people is that it's up to the county commissioners to make the contract with a local public health agency. That is required by law. Every county has to have a local public health agency in place, ready to go, and ready to serve the populations that, for the entity that it covers. Yes, there were some issues with the public health agency that our commissioners contracted with many years ago. I believe it was back in the 60s. And the comments I would have I have to preface with the fact that this is information I've read, and also that I've asked the commissioners about, just wanting to make sure I could answer questions the constituents asked them. I don't have a vote on this. This is between the county commissioners and the public health agency. And I'm one, and if you've listened to me at all, in my years in the legislature, I like to let local governments and local boards and local districts make decisions for their local areas. For example, the fact that the school board gets to make decisions about our local schools, I'm very happy about that. I don't need to go micromanage our school districts and tell them how to run the school, because that's their job. That's what they were elected to do. And different school districts throughout the state clearly have different needs for the people in their school districts. So same thing with the local public health agencies. I think that they have different needs in their different areas. And the fact that the agency that serves Douglas County serves 3 counties is important in this conversation. And this is one of the things that my commissioners told me, is that when they were having some meetings regarding dealing with the pandemic and just dealing with masking orders, dealing with whether the schools could reopen, dealing with all of the local issues that happen, the 3 counties that are part of Tri-County Health have very different needs, and the different commissioners and, for the different counties, as well as the boards that govern what's happening with the health orders, they were trying to, again, do a one size fits all. And it really wasn't fitting my county according to my county commissioners. Again, I would defer to my local county commissioners because it's their decision. I do not have a vote on whether they maintain the relationship that they've had for many, many years with the local health agency. And anything that happens is going to happen later. I believe they had at least a year's notice requirement. And at this point, they may be considering things that I don't know about that might be happening in executive session that I don't have a vote on, and I actually don't have the right to know until the general citizenry know it. All that being said, people did contact me saying, well, what about this? Please tell me what you think about this, or tell me what's happening here. And so I wanted to have good answers, but I work well with my commissioners as far as hearing what they're doing, but their decisions are uniquely different from the votes I make that affect the state on a state level. I hope that answers your question, because it really is more of a stay tuned. I think the different counties involved are going to be making decisions over the next few months as things happen. A couple of them are up for re-election. I think we're going to see some potential changes, but I also think that they will be well thought through and there will be a replacement before any changes take place.
Okay, thank you.
Thanks, Representative. Any final comments, Senator?
Just on that subject, I will say I do think that there's a lot of room for improvement in our public health process. We have this kind of unique structure where we have the Colorado Department of Public Health and Environment, which is really just kind of like a state supervising agency for the local public health agencies. So like Tri-County Health and others, often it's the counties that have their own public health departments. Tri-County Health is kind of one of the unique ones in the sense that it's a collaboration between 3 different counties in the metro area. But I mean, I do think that there's opportunities for a lot better communication, particularly when we're experiencing a pandemic like we are now. You've probably seen some news reports and publications around that the communication was not great, and that no one quite knew what the other was doing between the local public health agencies and the state public health agency, and that the local public health agencies didn't really feel like they were getting the support they needed from the Colorado Department of Public Health and Environment. So these are, I think, a lot of questions that are going to come up in the next budget cycle when we really start doing deep dives with each of the departments to figure out, are their operations efficient? Are they responsive to the communities that they serve? Because I think we've seen a few examples now where that was not the case. So kind of stay tuned. I think this will come up during the budget cycle this next round.
Great, thank you. Turn it over to you, Bob.
Okay, thanks, Rich. I have a question here. Either of you want to take it first. Has the budget crisis opened up new ideas for public-private partnerships? And if so, what might some of those be? Okay.
It looks like Representative Ransom was going to jump in, so I was going to hold off. And
either one, I'm sure we can both talk. Don't don't mute yourself, Dominic, because I think we both need to jump in. I would like to see some public-private partnerships. I do think it's a way of bringing in some efficiencies that we might not know of in government. If you just look at the big picture of the way government bureaucracies can work, I have been told a few times in my 5 years in the legislature, well, that's not the way we do things here. And that's true. It's not the way we do things here. But you know what? Sometimes a business that's been operating successfully can bring in some good ideas. Now, sometimes they won't work. in government, but sometimes they will. And I think that we've seen some of it in RTD, for example, where we've seen some private transportation within RTD. And I don't know for sure if that's something that will continue or that can continue. I know there's a separate issue with RTD right now. Just ridership has dropped off so much over over the last 6 months, especially. And clearly that's something we need to make sure stays in place. But I do, again, I would like to see more public-private partnership. I would like to see us let private entities handle things. I would like to see us contract with private businesses to handle certain things that we're not doing well, or that we would have to hire more FTE for, that would then be increasing the size of government. I would like to see the public-private partnerships work more than they are now.
Thank you. Senator?
Yeah, and I would say, we've seen areas where the state has engaged in P3s, public-private partnerships, primarily in the transportation area. CDOT has really embraced P3s, and they've, been working with a number of private companies to provide transportation services to our residents. So that's one area where it's been, I would say it has really been prevalent. But, I think even throughout this pandemic, you've seen it as well. I think that the executive branch realized early on that the state testing lab was not going to have the capacity to process the number of tests that they needed to complete for COVID-19. And so they reached out to private companies that have experience in this area. And a lot of our testing capacity that we've added as available to our residents has really come from the private sector. The state testing lab has, expanded its operations, has increased the capacity for testing, but nowhere near what we were going to need to try to figure out how the virus is spreading. And so that's one area where private companies really stepped up to the plate and helped the state with that. The other is, I know the executive branch is looking at what it looks like to partner with private companies around contact tracing, and trying to figure out, if someone does come down with COVID-19, who have they been in contact with? How can we make sure that they are notified so that they don't spread it to others? I know that's one area that they're working. So there's been a couple of opportunities now that we've seen that public-private partnerships have been helpful in expanding testing capacity, but also responding to the current crisis.
I just got a note that says something about Microsoft working with the labor workforce to do some kind of training and reskilling of the unemployed. Have you heard anything about that? It sounds like it's pretty new. So
that does sound new. I haven't heard anything yet, but I'll be sure to keep my eyes peeled for that.
Okay. All right.
Bob, how much more time do we have?
We're doing okay.
Okay.
Do you have another question that's come up?
I thought I'd seen one earlier that we may have passed over about broadband. I think it was just.
Yeah, I saw that one too. Yeah.
What are the possibilities, or maybe because I know I haven't followed it that closely, but I know the legislature, the JBC, has worked on that issue for last few years. So maybe if you could just kind of give us an update on where we are, particularly expanding to rural areas and what else might need to be done. Senator, if you want to start.
Yeah, absolutely. So back in 2018, we did pass a law that about this very issue. We have this thing called the high cost support mechanism, which is essentially a fund that all of the broadband carriers pay into to kind of expand broadband to areas that don't have it, what are traditionally kind of high cost areas. And there's no more high-cost area for broadband than rural areas, because obviously the terrain and what you need to get through to provide broadband to folks. And so that traditionally has meant that private carriers of broadband services don't really prioritize those communities because it's not really an area where they can make very much money. But we know that broadband is essential. I actually view it as a utility because now, especially now in today's environment, you have to have a good internet connection to be able to conduct commerce, to be able to, for our kids now, to be able to learn, they have to have a decent internet connection. For me to be talking to you right now, all right, I need an internet connection that doesn't, cut out every couple minutes. So we passed a bill a few years ago. The high cost support mechanism had started to develop a very large balance. And we were like, well, you know what, that money just sitting there is not serving anyone. And so the bill over a number of years, I think it was like over a period of 7 years, would start to allocate those to that money to broadband, rural broadband projects to dramatically expand the number of people who receive broadband services in rural areas. So now obviously we're 2 years in, so we're not quite, and as I say I'm talking about broadband, I just get a notice on my computer that my internet connection is unstable. So that's not good. Hopefully I'm coming through okay. But we're a couple years into it now, and there are far more grants going out to rural broadband providers than were before. And over the course of this 7 years, I think it's a little over $100 million is going to be dedicated to deploying rural broadband. It couldn't come at a better time because we are more dependent on the internet than ever to stay connected to people, to learn, to conduct business. And so more to come in that area, because over this course of 7 years, you're really, I think, going to see a dramatic shift in how many grants are provided for rural broadband under that new law.
Thanks. Representative, did you want to comment?
Just to the piece that I agree that broadband is so essential for people, especially now. So many of us working from home, so many people working from home. And then I have actually heard it also from kids in school. And Senator Moreno did address that well, that the needs are there. It's just a question of trying to make sure that that these mechanisms kick in as they were designed.
Great.
Thank you. Rich, I'm going to take a couple minutes here and introduce Jody Waterhouse from CU, who is one of our sponsors today, and to talk about what she is doing with the Multi-Disciplinary Center on Aging. As I don't think a lot of people are aware of what that is, and it's really important for people to know about it. They're doing some really great work, and take it away, Jody.
Well, thanks, Bob. And thank you to Representative Ransom and Senator Moreno for being with us today, and to all of the participants who have joined this webinar. This has been a terrific dialogue, and that's why we create these spaces, so that we can have these discussions with each other. So thank you very much on behalf of all the board. We appreciate you all being here. The Multidisciplinary Center on Aging, located at CU Anschutz, is really there to support all the work that you're doing. Certainly at the Capitol, as well as through our communities throughout our state, other higher ed institutions, and industry. And we do that really kind of in 4 areas, being that we are the only academic medical campus in the state of Colorado. We have an expertise area that we lend to all of you so that you can make sound decisions about issues specifically pertaining to aging. And so we do this really in 4 separate areas. Research, we're a very large research institution. So we have teams that are working on aging, the complexities of aging research really across the country, with collaborators from all over the country at different higher ed institutions and industry. So we've got an extensive outreach for that. We also have an education pillar that we're one of the top fellowship programs for medical students to come do geriatric training. And that's a one-year geriatrician training program that those medical students have decided to go into the work of geriatrics. And in addition to training medical students, we're also training nurse practitioner and physician assistant students in specifically geriatric training. In the state of Colorado, it is dismal as far as our numbers of specifically geriatric trained healthcare professionals. We can count on two hands the number of geriatricians that we have servicing rural Colorado. So those communities are even harder hit with a lack of geriatric trained healthcare professionals. And so we're doing our darndest to train these folks to get them out into these communities. We also have clinical care, of which we see about 3,000 older adult patients per year who are 75 years or older and have at least 2 comorbidity diagnoses that come to our clinic and are seen by our geriatricians, but also it's a training ground for our pharmacy students, our dental students, our nursing students, and our medical students who come and work and understand how to work better with older adult patients, hopefully encouraging them to go into a geriatric specialty within their area. And then our final pillar is really our area where we're out across the state through our outreach and engagement. And the information is very confusing for older adults, especially during the pandemic. It was getting very muddy. What was real, what wasn't, what should I be doing, what should I not be doing? So we deploy our expert clinicians out into the community and then through different platforms like we're doing today, even through Zoom, to really try and give them the facts about healthcare and how to age well. And we have a number of partnerships that we're doing that through the Denver Public Libraries. We're doing it through AARP. We create programs where we feel there are gap areas of information for older adults and those that are treating older adults, working with older adults, for us as the experts in the state to provide. And one of the areas that we were having a great time and really proud of working with Colorado Senior Lobby and certainly Senator Jesse Danielson, who sponsored Senate Bill 22, which you two might be very familiar with. It was moving and shaking right along, and then the pandemic hit, as many of the bills had the same circumstance. But that one was a loan forgiveness for geriatric trained nurse practitioners and physician assistants to work in rural and underserved Colorado. And really a question I have for both of you is, you know, we understand the budget shortfalls and everyone's trying to get a piece of the budget, obviously, because everyone thinks their program is the most important. However, if we only can count on two hands the number of geriatric trained healthcare professionals that we have servicing our state, not a certain community, but our state. Because last year in the country, there were 400 geriatric fellowship spots that went unfilled. So we really need to incentivize and encourage healthcare professionals who are coming up, being trained to go into geriatrics so that our older adults not only are getting the right resources and services in their community, but they're also being seen by the right healthcare professional. If I had a heart issue, I would want to see a cardiologist and not my primary care provider. So how do we ensure that that doesn't die, certainly that bill, but are there strategies that we can do just to get kind of our big toe in the water to get started so that we don't have to wait another 2 to 3 years when the budget finally kind of evens out a little bit to then begin the process of how are we going to train this next generation of healthcare professionals to ensure that they're here to take care of this population that's nearly doubling in our state?
Yeah, I think it's a really good question. I'm really familiar with Senate Bill 22, and
thank you.
Yeah, obviously the pandemic upended a lot of bills and legislation, so it was unfortunate to see because obviously understand how much it's needed. You know, I would say I would really look to other programs that we've developed over the years. I know we have a fellowship for optometrists. We have family medicine residency programs. I would really look to those to see how have those been successful in getting more people into the profession that we obviously need. Obviously, we need optometrists, we need family medicine providers, but we also need, clearly, geriatric providers. And so I would look to those programs to see how they've, because each of them produces an annual report, and see how they've been successful, what their statistics are, to really, that'll obviously just help make the case for a program like this. Mm-hmm. I do know, I think Senate Bill 22 had I want to say like maybe a $7 million cost. I can't remember the exact amount, but
not quite that much.
Not quite that much, right? But obviously, we're going to be in a period, unfortunately, I would say, over the next, certainly this past fiscal year, but probably next fiscal year as well, where it's going to be challenging to add any kind of new programs that have new fiscal needs, only because as Senator Rankin mentioned, we're still in a place where we're probably still going to have to cut $1 billion from next year's budget. But I would really look to those other programs, because, clearly this is something that the state of Colorado has decided that, this is appropriate for the state to invest in, and that we want more people to be in these professions. And obviously, if you can model a program after one that's already been successful, that obviously goes a long way.
Mm-hmm. Thank you very much.
Representative?
Thank you very much. It's really just the same thing. When we're in a time of decreased revenues, it is so difficult to try to add something new in, because that means that instead of an overall potential $1 billion decrease, we would have to decrease enough to fund the first stage of your requested program. We really would need to take it away from somewhere else. And that is just such a tough thing to even say out loud, but it's a very difficult thing to have to face then on paper, which both Senator Moreno and I, we look at the graphs, we look at the charts, we know what the numbers are. And it's a difficult thing to have to recognize that, what, the numbers we just have to be realistic with what's here.
Right.
So I'd like to ask kind of a follow-on question for that, Jody. In that is a little more general, I guess, in terms of workforce development, workforce training. We understand the issue about the budget money, but can you give us your thoughts about more creative ideas to get funding for these kinds of issues outside the state budget?
Yeah, the only suggestion that I have is, obviously, in prior years, we've seen hospitals and other healthcare institutions really step up to the plate to, fund fellowships or fund different programs that help get more providers into the system. Now, obviously, given the pandemic, hospitals are also kind of unfortunately having to tighten their belts as well, because they, for a period there was a time where they couldn't do the elective procedures that they do that are really kind of a huge source of their revenue. And so I know they're experiencing challenges as well, but for the family residency programs, I do know that a number of some of the higher education institutions and some of the hospitals also contribute to kind of match the state commitment for those programs. So that's maybe something that you can look into. Obviously, higher education institutions and hospitals are having their own fiscal challenges under this environment, but that might be, that's always just as we mentioned, kind of like public-private partnerships. It's just a way to leverage the state dollars to go even further when we do have other entities that are willing to match or kick in some dollars to get some of these programs off the ground.
Okay, thanks.
Well, thank you very much to both of you. I really appreciate that insight. And if there's anything that we can do at CU, which sounds like you have already called upon us for some things, please let us know. We really appreciate it.
Okay, thanks, Jody. Rich, do you have another question? You're on mute, Rich. Rich?
See, I forgot to unmute. Sorry.
Okay.
The last question I have here, I think, is just asking if you would comment on reports of employees of public health agencies enduring abuse during the pandemic. Did either of you want to comment on that? Maybe.
And I'm not completely familiar with the situation, and certainly if there's more detail, or if there's things that folks want to ask that they don't feel comfortable asking in a more public environment like this, certainly please always feel free to email me, and I'll try to get some answers into the bottom of it. I do know that for the Colorado Department of Public Health and Environment, they've had, I don't want to say it's a mass exodus, but they've had quite a bit of turnover in that department. And I know that there were some allegations of misconduct, and that employees were not being treated very fairly or well. And so if that's the case, then that's something certainly we want to hear about. There's not a lot that we can do with the more administrative procedures of employment with the state. But there is obviously, like, the Joint Budget Committee is on the forefront of holding different state departments accountable for their conduct and for getting to the bottom and getting answers for people. And so, if there are issues that you think we should be aware of, please always feel free to email us. We'll do our best to get some answers. But those kind of employee issues that we've heard about in CDPHE are things that are known, and that we'll be sure to be asking the department about when they come forward with their budget requests.
Great. Representative?
I think Senator Moreno answered the question well. Again, I know we've said this a few times, but stay tuned. We can ask the department questions when they come in with their budget requests, because we do hear from each individual department. And it's very helpful, because the JBC, we've been known to ask some tough questions. And when you get things on our radar, I think between the six of us, we're pretty willing to bring forth those questions.
Great. Bob, we'll turn it back to you.
Okay.
To wrap up.
Yeah, we need to wrap this up. I did have, if you can indulge me for just a couple of minutes, I did have one last question I wanted to ask you, and that is, what can Colorado citizens do to help with the ongoing budget crisis? I mean, it's a big question, but in 60 seconds, what do you think?
Spend more money.
Spend more money.
To be just completely honest, I mean, so much of our economy, truly, you may have heard the statistic before, 70% of our economy is consumer spending. It's the money that you all put out into the community. And so that is, honestly, that is some of the best ways that you can help the state budget crisis. The more that we can get, when we start to get back to a place that's a little bit more what we're used to as normal, I do think that economic activity is going to pick up. I do think people are going to be spending their money again. But I think it's going to be a challenge. It's going to take us a while to get there. I think we're trying to be creative. Restaurants are expanding into patios, and they're doing everything that they can to try to get back to, honestly, the economic activity that they were at prior to this pandemic. And so, it's going to take a while, and I'm hopeful that we're going to get there. But I know people are worried. People are, the messages have come from the state that, you're safest when you're at home, and that's, that while that's true, right? We want to make sure that no one is getting unnecessarily exposed to this, to the virus, and putting themselves in danger. If you feel comfortable doing so, get out there, right? There are businesses that are hungry for your patronage. They are, they need your support. And the more that we can get out there and support our local businesses and spend our hard-earned dollars, the quicker we're going to be on a road to economic recovery. And that translates into obviously having more revenue for the state budget as well.
Great.
Representative.
It's been a long 6 months. I remember when we first had the shutdown and people were really just buying groceries. Remember, even restaurants were closed and people were just staying at home and cooking and not going out at all. The restaurants were closed. So I know that when we discussed tourism a couple minutes ago, Senator Moreno mentioned that the hotel vacancy rates had been flip-flopped. Yet it's not just the hotels that suffer, it's the restaurants around them. It's the activities around them, you know, that people might pay an entrance fee to. Right now with restaurants, yes, I think during the summer, there were a lot of people that went out to restaurants and were able to go out because they had the patio areas, but it's starting to get cold. Hey, we had snow last week. You know, this is Colorado. It's the weather's changing fast, and we're not going to be able to keep doing the patio dining. Yet back in April, when the restaurants were first starting to open up in April, maybe April and May, I still remember my commissioners, at least a couple of them, would do on social media, they would post, look what I just picked up from such and such restaurant, you know, and they would encourage people to go to restaurants, even if they were ones that maybe were tending to want to eat at home or tending to want to just cook. It's like, no, go be, you know, patronize your local restaurants, get these tax dollars moving, and then tip nicely, because those workers need those tips too. And I still see that, guys. I still see it from everybody, from every level of income. So all the way from the fast foods that people might not have in the past necessarily gone through a drive up. Some people are doing that still, and some people are actually getting these really nice meals from restaurants. I think that it's been just a really nice thing to see people tipping well. Honestly, I see that a lot, and I've been told that a lot by restaurant workers in my area. And I hope that that's happening all over the state. But it really comes down to what Senator Moreno said. You know, the economy needs to get back into a sense of normalcy in order for the budget to reflect those dollars, in order for then us to be able to function as people may expect us to as a state government.
All right, thank you both. We'll wrap up here, but Senator Moreno, Representative Ransom, we appreciate your time so much. And if people have questions after this, we will email those to you as you suggested. And we again want to thank our sponsors, which I'll flash them up on the screen here again. And we appreciate them very much, and everybody who's worked on this, and all of you who have attended today. So thank you so much, and we will see you all again in a couple of weeks.
Thank you. Thanks again. Appreciate it.
All right. Bye-bye.